There's nobody else in there. I delivered it with the sheet and one glove.
Literally, when you said the husband said no, I started sweating.
Well, there was a full urinal on his table, and he just...
Hey guys, welcome to Nurse Talk, the podcast where we talk all things nursing. I'm your host, Mia, and today we have a very special guest, Miss Kristy.
Hi. I'm happy to be here. Thank you for having me.
Yeah, of course. So this is my cousin's wife. They actually just got married about a year ago. Yep. I'm going to put up a couple pictures because you guys just looked amazing. I remember actually when I first went to clinicals in nursing school, you guys had just first started dating.
Yes.
And I remember seeing you on the floor and I was like, I think that's my cousin's new girlfriend. And I was like, no way. I remember that. That was really cool.
Yeah, that was so cool. That was so funny.
Yeah. I was like,
got to watch a C-section together.
Yes. I almost passed out. No. Okay, so I always like to start with why you became a nurse. Was there a specific moment or thing in your life that
I wish that I had this life-changing story about why I wanted to become a nurse. I don't. Honestly, when I was going to college, I was in between working in hotels or being a nurse. Oh, wow. I've grown up going to theme parks, loving that. And then my parents actually suggested to me, oh, what about nursing? You'll always have a job, job security. There's always a need for nurses. They're so well respected. So it's oh, yeah, okay, I don't know. And I went through my 2 years of just my regular AA degree. And I was I'll decide whenever I get done with that. And then that time came and went. And I was oh, my God, what should I do? Yeah. And I was well, I don't think I want to work every single weekend of my life or every holiday of my life in hotels. And so I was well, nursing, you get the 3-day-a-week schedule. I'm going to learn a whole lot. I want to make my parents proud. So that's basically why I chose nursing.
Yeah. And you only have to work half of the holidays.
I know. Yeah, not every single one.
And only every other weekend.
I know.
Oh, that's sweet. That's smart that they led you in that direction. Yeah. Because it is true. We literally will always have a job no matter what.
Yep. And it's so weird because nobody in my family is a nurse. I have a couple medical people, but nobody was ever actually a nurse. So it was weird that they were yeah, do that.
That's so sweet because I remember at your wedding, your dad had this beautiful speech and he was talking about how much he loves that you're a labor and delivery nurse. Yeah. Oh my God. It was so sweet. I was let me not cry.
I know. They're so cute.
Yeah, they are. Okay. So you first started in Neuro Trauma. How'd you end up there?
That chose me. I did not choose it. But I actually ended up really liking it a lot more than I thought I would. When I was in nursing school, going through all of the different specialties and things that we do, I didn't know what specialty I exactly wanted to be in until I got to the maternal childbirth class. Then I was okay, this is my niche. So when I was applying to jobs, you're starting as a new nurse and you're just basically applying to whatever residency you can get into. And I was told that they didn't accept new grads into L&D. Come to find out later, that's not true. You just had to know somebody.
Absolutely.
So they actually picked, where I interviewed before, they picked what unit they felt you would be a best fit on. So wouldn't start me in L&D, but put me on a trauma unit. Okay.
That was so sweet
of them. As a new grad. Yeah.
I feel a neuro trauma floor is traumatizing.
Yeah.
The first time I went on there, I was hold on.
You're oh God.
This is intense.
Yeah.
Yeah. I was shell-shocked.
Yeah.
For sure.
It's crazy.
For sure.
Really crazy.
Yeah. What was one of the first shocks for you when you first got on that floor and started training?
Oh gosh. I think honestly, the amount of times that people are hit by cars, so severely. I didn't realize. I know that happens, but most of the patients on that floor were pedestrian versus auto, bike versus auto. A lot of people were crossing crosswalks in St. Pete or Clearwater. So now anytime Josh and I go downtown, he's there's no cars coming. Let's just walk. I'm no, we have to wait for the signal. We are not crossing before it says we can cross.
Oh, absolutely.
Even if there's no cars, because I've seen so many stories and young people who are on vacation being hit and then they're intubated or can't move their arm anymore and things like that. So it's so scary.
It is so scary. I remember one time I was on the pediatric unit just I think I got floated there. But however, there was an 8-year-old there who had been there for a little over a month, I believe. And it was because she was sitting on a bench reading a book and got hit by a bus.
A bus?
A bus. And it took out her entire pelvis.
Oh my gosh.
And I'm like, her life may never be the same.
Yeah.
And she was sitting on a pedestrian bench just reading.
Oh my gosh.
I'm like, I am deathly afraid.
How? Yeah.
I'm also one of those people, if I don't have the pedestrian lane, I'm not going anywhere. Because you never know, because people will come down like 100 miles an hour.
Yeah.
And it could ruin your entire life. Once you see, getting hit by a bus is one thing, but once you see like the aftermath and how long it takes, if they ever do recover, no thank you. I'll wait the 30 seconds.
Yes.
Oh my God.
Like, 30 seconds versus a lifetime. And it happens like that. You get hit by cars. It's crazy.
Also, you want to be able to sue.
Yeah. You gotta be alive.
You can't sue if you're wrong.
One time Josh almost got hit by a like the tram like at Epcot. Oh, and I literally pulled him out of the way, and still to this day he's so mad. He's like, I could have sued Disney. It could have been Josh's world. And I was like,
been great. Why didn't you get hit by that freaking trolley? We could have been millionaires.
I know. I ruined it for the whole family. But yeah. It's like, or you could have had a bunch of surgeries and been miserable and addicted to pain meds. You never know. So you're
That's
welcome.
Probably would have.
I saved your life.
Okay, so what would you say is one of the most common misconceptions people might have about brain injuries?
I had a patient once. He was doing some work on the roof and he fell off of a ladder. And I remember I was like a brand new nurse. They like pushed us off internship really fast. And I remember his daughter was there and she was just so confused as to why he was so confused. Like he would say things that didn't make sense, or he didn't know who she was, but then would know that who she was like the next minute. And she was like, why is this happening? I don't understand. Like he just knew who I was. So how can he not know who I am now? Yeah. And the brain takes so much time to heal. Like nobody's same recovery path is linear. Everybody's recovery is different, and it takes so much time for the brain to heal.
What would you say is one ethical dilemma that neurotrauma nurses often face?
I feel like when you have an older patient, when families are like, yes, do everything, pound on their chest, code them, and they're 90 years old. And of course, you never want your loved one to die, but we know the severity that coding a elderly patient causes, even just any patient.
Absolutely, yeah.
So I feel like that was always a really tough thing.
Yeah, we see that a lot. I think no matter what floor you're on.
Yeah.
Unless it's like a transition, observation and you're really healthy. Mm-hmm. Otherwise, I feel like a lot of people see this problem. Yeah. Where it's like their grandmother is 100 and they're like, do every single thing. And it's like, no, death is a part of life.
Yeah. And letting somebody go peacefully is sometimes better than coding them, breaking their ribs, doing all these invasive things. But it's hard. It's hard to watch your loved one go through it. So I get it. But yeah. Yeah.
Okay, so would you like to share any memorable stories from neurotrauma?
Yeah, sure. I've actually met, she's actually my best friend in the world. We met working on the trauma unit together. Her name's Jory, and she's wonderful. We're still like best friends till this day. Aww. And she's...
Hey, Jory!
Yeah, she's probably my like favorite thing to come out of nursing, honestly. It's because you bond over like the crazy stuff we saw in trauma, and then we ended up moving over to labor and delivery together. So like we've never not worked on a unit together. So it's like a special bond that we have. There's this guy, he got into a motorcycle accident and he was drunk. And so I feel like a lot of people that we would get, especially working night shift, they would still be drunk. And by the time they got to my floor, and he actually had to have, I can't remember the exact surgery he had, but he tore something in his knee and he had to have an X-fix on and things like that. Wow. Well, he couldn't get out of bed and all he wanted to do was get out of bed. And he was like in his right mind and everything. And he just wanted to get up and go to the bathroom. And I explained to him, like, you got to use the urinal. You can't get up. You have this massive thing on your leg. Like he was like fresh post-op. Well, he didn't like that. He tried getting out of bed anyway. You tried de-escalating the situation as best you can. Well, there was a full urinal on his table and he just flung that, and you gotta like duck and dodge, call code grays. Yeah.
Did any of it hit you?
No, it all
thank
hit
God.
the floor. But then, of course, then you got to clean it up, and then it's just a mess, and he's just a hot mess. Yeah.
What a jerk. That's so gross. So
Yeah.
what, like, can you imagine getting a freaking urinal spray of, no, quit.
Yeah. Yeah. Yep. As a brand new baby nurse too, I'm like,
Sir.
yeah.
Why?
And coming from like working at Target and like serving and stuff like that, you know, the customer's always right. And I specifically remember I had one charge nurse. I went to her and like told her like that some other patient was talking to me in a way, and she was like, oh, Kristy, this isn't like the food industry anymore. You don't let people talk to you like that. And she like grabbed my hand, went and marched in there and like told them that they're not going to talk to her nurse like that. And she's like, now? She's like, you don't have to be rude, but if they're being rude, you don't have to deal with that. You can tell them. And I was like, oh, okay.
Yay. It is hard to build a backbone, but you eventually do.
Yeah, it's true.
Especially with annoying grown men.
Yes.
So how'd you finally get into labor and delivery?
I honestly just kept applying every single time there was an opening. I would apply. I probably drove the hiring managers nuts because my name was always there, like always emailing them like, hey,
And
it's me again.
You have a really interesting name.
Yeah.
Yeah. So they're like, so they noticed it.
Yeah.
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 They're like, this girl again?
I know. Yeah. They're like, oh my gosh, we got to get her in so she stops bothering us. So yeah, I just kept applying until eventually I got in. Before I started my first L&D job, they wanted me to have 6 months of experience. So like at 5 months, I started pestering them because I'm like, hey, my 6 months is coming up. And I ended up transferring into labor and delivery after doing 8 months of trauma nursing.
That's awesome. You didn't have to suffer that long.
Yeah.
And I'm sure, like, I don't know. I'm so in my niche now, but I look back on, you know, doing med surge.
Yeah.
And I'm like, that was actually really important.
Yeah.
Are you kind of happy with the fact that you did have to start in neuro trauma, or are you I didn't need it?
No, I'm really glad because I feel like the more experience that you have as a nurse, it like helps shape you, and it helped shape me in some ways. And it makes me very grateful for the hard days that I do have in labor and delivery because it will never be 7 patients again or like wiping butts or
What is something that you say often on the L&D unit that would sound completely unhinged on another unit?
she's gonna get cut, or they gotta cut her, or what if they cut her, like something like that. Yeah.
Ooh.
Yeah.
I don't want to be the one that they're talking about.
I know.
Oh, does that happen often?
We're basically just talking about C-sections instead of just saying like, oh, she needs a C-section because the baby's decelling or whatever it may be, baby's breech, whatever. They're like, oh, they're gonna cut her at 2:00. They're gonna cut her
That's
at.
horrible.
It sounds like so weird. And I remember the first time I heard it, I was like, what? What do you mean? And they're like, well, like cut because they make the incision. It's just something they say. And both L&D units I've worked on, like everybody says that same like slogan.
So, okay, so when you first said that, I was like, in my head, I was thinking like an episiotomy.
Yeah, no, we don't say it for that. We're all like, oh God, no. I mean, we don't want a patient to have a C-section, obviously, unless they need one. But for episiotomies, no, we really try to avoid that.
Like right when you said that, I was like, okay, on a scale from 1 to 10, how dramatic are partners in comparison to the patient?
Oh my gosh. I feel like it truly just depends on the situation. Like we have some dads that are just over in the corner, couldn't be bothered with anything, which I feel like is its own kind of dramatics. Cause I'm like, dude, really? Like your wife is so strong, like going through all of this and you just couldn't be bothered to like be woken from your nap.
I've seen that and I want to like just flip them.
I've kicked some chairs before, like hello. Yeah.
That's horrible.
Gotta get up. Yeah. It truly just depends on the situation. Sometimes you have some dads that want to try to control the situation as much as they can. Yeah. You see like all sorts of walks of life and get all sorts of like family drama tea in those rooms.
Okay. Can you kind of give me an example of how the man would try to control the birth?
I've had it to where a dad you could tell that he didn't want her to get an epidural, and she's like trying her hardest to not get an epidural. And you can just tell sometimes a patient will be like, I don't want an epidural, like do everything you can to convince me out of it. Like, okay, that's one thing. But when you have a patient who's like in pain, she's getting to a point in her labor where it's just too much, and the dad is like, no, there's no epidural, it's more of like they're not supportive about it. Like, they're not like, you can do this, you got this, like rubbing their back. It's more of like they're kind of standing back and just kind of being like, no. Yeah. And you're just, well, that's when you really have to advocate for your patient and be like, you're not the one pushing this baby out. You're not the one feeling this pain. And because I don't have a problem being a bad guy. I tell my patients all the time, I'm like, if you don't want your mom in here, you don't want your mother-in-law in here, like, I give them a little code word. They ask me for grape juice. We don't even have grape juice. Then that's my key to make something up to get the person out of the room that they don't want in the room. And I tell them, I'm like, I don't care being the bad guy. I don't have to go home to your mom or whoever, so they can blame me all they want.
I love that. Can you be my L&D nurse? Yeah. How do you approach a situation like that? Do you just like take the mother-in-law in the corner and say, hey?
Usually what I say is, okay, we're going to run some tests or do a check, and we need everybody to step out of the room. It's just going to be mom and dad right now. We'll call you when she can come back in. Or sometimes I'll be like, it's quiet hours, it's rest time, like hospital policy. I just make something up. It's hospital policy, like she's got to rest for a couple of hours. We'll call you when we're ready. Yeah.
Love that.
Yeah.
Love that type of energy.
Yeah.
Because it is true. Like, they may not remember your face or your name, but she's going to be like, that one nurse was amazing. Yeah. She helped me. And you don't
I hope so.
Of course they do. That's like one of the most traumatizing moments of their life.
That's crazy. It is so crazy.
Literally, when you said the husband said no, I started sweating.
Yeah.
I was like, screw you.
It's insane. Yeah. Like they think they know the pain because they like do whatever research, or like just because some women do it, it's not for everybody. Like, majority of people I feel like do get epidurals, at least like in the patient population that I have, and that's fine. Like, whatever they want to do. If they want to do it without an epidural, if they don't, like, it's their birth. I feel like they should get to experience how they want it.
Oh, absolutely. Have you ever had a dad pass out?
Yeah, numerous times.
Really?
Yeah.
Oh my God. Does anyone run over to them or?
Yeah. So depending on what's going on with the patient, because obviously if we're like actively delivering, I can't go like rescue him. We'll have to call for extra people to come in and kind of help. But everybody's really quick. We're like, hey, just bring some juice and crackers. Dad's going down. And people like run because they know. Some cold rags, lay them down, elevate their legs.
The drama.
Yeah.
Literally.
And I always try to like watch out to see if they're getting queasy. I'll like make them pull up a chair behind them like before we start pushing or something. And a lot of people are like very forthcoming. They'll be like, I don't do well with blood. Like, and I was like, okay, well, thanks for letting me know because I have your wife and your baby to take care of. Like, can't take care of you too. So
exactly.
It's nice. Yeah.
It's funny because like some people are like, I want to see everything. And some people are like, I'm not looking.
Yeah.
And like, I'm sorry, but like if you're in the middle of it holding a leg, and you say you don't want to look, I feel like they end up looking anyway.
I feel like, yeah, most do. But some you have where the wife, she's like, do not look. I don't want you to look. And they will like, they're just holding the leg, like staring at her face. Like they're like, God, I cannot cross that barrier because she will kill me.
Or like just punch them in the face.
Yeah.
What is your, if you know, L&D nurse pet peeve?
I don't know if it's, I mean, I guess it's kind of a pet peeve, but it irks me when patients come in and I'm trying to educate them about something about the labor process, induction process, whatever it may be, and they talk to me about TikTok, that they saw this on TikTok and that TikTok says this is bad and it should be this way or whatever. And I'm all for a patient, like doing their research, trying to prepare. Like, I totally get that, but I am trained in this. I'm educated in this. I have clinically delivered more babies than they have. The doctors are trained in this for years and years. So sometimes it can be really frustrating when we're trying to educate them about like what really happens and they just want to believe on TikTok, because I feel like, you're more inclined to share, like write a review even if you have a negative experience. Like if you have a positive experience, you're just like, oh yeah, that was great, whatever, go on about your day. But if something bad happens, then that like really sticks in your brain. And so I've seen so many things on TikTok about like people scaring other people with their epidurals or with a C-section or even with a vaginal delivery. And I'm like, well, just because one person had a traumatic birth, it doesn't mean that you're gonna have a traumatic birth. Mm-hmm. And so I feel like sometimes it's hard for people to differentiate that, like TikTok, from what is actually like really happening, because every birth is so different.
What would you say are the most like common misleading like topics from TikTok?
A lot of people are like very, very nervous about the epidural. When they come in, like that is their number one thing that they're scared for. They will like hold off as long as they can before getting their epidural because they're so scared that they're going to get paralyzed or they're going to have all of these issues from the epidural, or it's going to slow down their labor and cause them to have a C-section. And then once we walk them through and they actually get their epidural, a lot of times after they'll be like, okay, that wasn't as bad as I thought. Because I feel like the internet like hypes everything up. The internet will show you a needle that's like this big. And I'm like, it's big, but it's not that big. Like we're not going to talk about how big it is, but it's not that big. I promise. And they like, look. They numb you before. Yeah. So I feel like that's a big thing.
Do you have any memorable stories you'd like to share from L&D?
Honestly, one of my like favorite things about being a labor nurse is when people I know come in to have babies. Yeah. So it's already so special being a part of somebody's most important day of their life. But when it's like a family member or a friend, it's something just so special about that, like getting to help them bring their baby into the world. And it's so funny because I remember I had a patient once. I've known her for a long time, and her sister was in the room. And I remember her sister being like, isn't this weird? Like, Kristy's seeing your vagina. Like, she's checking your cervix. Isn't that weird? She was a nurse too. And I remember I came back in and she asked me about that. She's like, is this weird for you? Like, I requested you, is this weird? I'm like, not at all. I'm not thinking about that when I'm checking your cervix. Like, I'm thinking about how close are we to meeting your baby? Like, what other things do we need to do? What position is your baby in? And things like that. So that's a really special thing, just getting to be there on somebody's like best day of their life. Yeah. So in labor and delivery, like things can change on a dime. Like when I have patients come in and they always ask me, how long do you think it's going to be till the baby's here? That is the $1 million question. If I knew, I would be so rich. Like we will never know. I had this patient one time. I had just checked her, like literally checking, taking my fingers out, and she was 3 centimeters, like a tight 3 centimeters. And she was like, no, the baby's coming. Like you did something in there. The baby's coming. And I was like, I didn't do anything. I just checked you. Like, I'm so sorry. Like cause I'm always like, if you need a break, if you need me to stop checking, if you don't want me to check you, like you just let me know. It's fine. It's your body. Like I want you to be comfortable. Anyway, I like turned for a second to take my glove off and turned back, and the head was hanging out this much. And I was like, oh my gosh. So it literally like maybe 60 seconds, like 3 centimeters to the head coming out.
Did her cervix rip?
No. Mm-mm.
Wow.
Yeah, it's crazy. It's so crazy.
That is a good point because it is so hard to tell.
Yeah. You truly never know. Like the more babies you have, typically the faster they come. And I can't remember, it was her second or third baby or something like that. And yeah, within 60 seconds to like a like firm 3 centimeters to no, we're having a baby. And I delivered the baby. There's nobody else in there. I delivered it with the sheet and one glove, like half a glove. And I was like, okay, well, you were right. Yes, baby's coming. God. Yeah. So when somebody tells you like this baby's coming, they're probably not lying to you.
Yeah, because they can feel it.
Yeah. Yeah.
I wonder what like that must feel like to feel like it's coming, but someone's like, oh no, like you're only 3. Yeah. We got a little while.
Yeah.
And you're like, but this feels like that like kind of confusion.
Yeah. And I was a newer labor nurse at the time too. So I was like, oh, you're just 3 centimeters. It's okay. Turn. And I'm like, oh. And now I'm like, okay, you feel like baby's coming. Can I check you again? Is that okay? And then they're like, yeah, sure. And then, yeah, most of the times, like, they know. It's crazy.
How many times would you say that you personally delivered the baby?
Probably like 5.
That's
5
a lot.
times. Yeah, yeah.
Because it just happened so fast.
Yeah,
the doctor can't get there.
It just happened so fast. Yeah. Mm-hmm.
Which one do you prefer? Do you think it's like fun to catch the baby?
Oh no, that's above my pay grade. I mean, it's like the adrenaline is like crazy, and then after it's kind of like, oh my gosh, like what a rush. But no, above my pay grade. I want the doctor there because if something goes wrong, oh God, I don't want it just me in the room.
Oh, 100%.
Yeah.
Also, is it scary to grab like a literal slippery baby? Like that scares
Not
me.
anymore. No, I feel like when you like first start, it's you're everything you learn is like, oh my gosh, protect their head and neck. They're so fragile. Like you don't want to break them. And it is true, but these little newborns, they're like so resilient. I feel like people look at us like we're crazy all the time because we'll wrangle them like grab behind the neck and grab
100%.
a thigh and you'll never drop them.
Oh,
I'm
100%.
yeah.
That's so true. I literally, as long as you have this and like maybe just their
A little
pelvis
chunky
in any
thigh,
way,
yeah.
like you're good.
You're not going to drop them.
Either
Yeah.
way, you got one.
And the parents are like, oh my gosh. I'm like, I promise it's okay.
Aw. How would you describe the overall like morale and culture in the L&D unit?
I feel like probably everywhere in nursing, like I feel like it can be a tad bit cliquey, but honestly, I feel like the group of coworkers that I work with currently, like we work in such a team and like everybody gets along with everybody pretty much. If there's an emergency, it doesn't freaking matter. Like everybody's coming to your room. No, I feel like at least nurse wise, like nobody fights, nobody argues. Like I feel like we're all in it together. And so it's like makes all the difference is having a good supportive team. And I definitely have that. Like I love my coworkers. They're all so great.
Oh, that's
Yeah.
sweet. I have had a couple conversations with people who work on L&D and sometimes I get a mixed review
Yeah.
of that very cliquey, you know, kind of environment. And I have heard that like, I also have this one friend that worked on med surg, worked on ICU, and then went to labor and delivery. And she was on there for like 6 months and was like, I have to leave because the nurses are so mean. I'm like, maybe it's
that's
just the one
terrible.
place.
Yeah.
And, you know, maybe there's like 1 or 2 bad eggs that kind
Yeah.
of like
yeah. Take over
the unit and kind of change the, you know, the environment. So I also noticed that every year you have like these little bows of blue and pink and you count how many boys and girls that you delivered.
Yes.
Is that something that all L&D nurses do? Because I've only seen you do it.
Yeah, I feel like there are some people that will keep track, and it's kind of nice because our like charting system will tell us at the end of the year like how many deliveries we did.
Really?
Yeah.
Aw.
So that's kind of how I feel like most people keep track probably. But when I started in L&D, it was just before New Year's, and so my mom told me, oh, every New Year's Day or whenever I'm off around that holiday, we should get together and count like how many babies you delivered. So a lot of people will count just like where they're the primary nurse, but to make it more fun, I count every delivery that I'm a part of, like that I'm in the room for, that I help, just so that it's more fun to count. So I'll text my mom the date and either boy or girl, and she got this like little cookie jar thing, and she has pink sticky note or blue sticky note, and then she'll just write like 1126 boy, and she'll put it in there, like whatever I text her. And
yeah.
then every New Year's Day that following year, we group them and we count, and it's so much fun.
That is so sweet
Yeah.
of your mom.
Yeah, it's so cute. And
That
it's just
is
something
so-
fun that we do together too.
That is really sweet.
Yeah.
What is one moment from L&D that stuck with you forever?
It's so hard to pick one because we're with people on the greatest day of their life and also the worst day of their life. Like I always tell people a hard day in labor and delivery is really hard because a big misconception is, oh, you cuddle babies all day, you do this all day. And like after delivery, we only have the babies for 2 hours. And like we have a newborn nurse that comes in, takes care of them. So you're mainly with the mom. Of course, when the baby comes out, then like I dry and stimulate and do all of the things for the baby in that moment. But the hard days too, when you have a patient come in and their baby was just fine yesterday and today it's no longer alive and it's terrible. Like those moments really stick with you going through
How
it.
do you find yourself like dealing with that?
It's always so hard and so terrible because again, like each person's story is so different, like whether or not it's an early loss or a full term loss, like both of them are both so hard to me because it's still their baby. Like everybody thinks, oh, I'm past my 20 weeks, like I'm okay, nothing bad can happen. And then suddenly your next appointment, there's no heart tones, or like they see something on the ultrasound, and it's really sad. But those moments kind of stick with me, and you create a bond with your patient, no matter like what they're going through. And I feel like that's something that you can't get in any other career besides nursing, is like the special bond. Like I may have just met you today, 30 minutes ago, whatever, but you spend a whole 12 hours with them. And I always tell my patients, I'm like, we're gonna be best friends by the end of this, because you get so close. And I feel like that's something that sticks with me. Like there's a bunch of moments in my career, but I feel like the main thing is just the bond that you create with people, no matter what they're coming in for.
Oh, that was really beautiful. We'll end L&D on a funny note.
Okay.
What would you say is the most like unexpected, like funniest thing a partner has like yelled out during birth?
Oh my gosh, I always think it's so hilarious. So when it's a surprise birth and the patient wants the dad to announce the gender and they announce the wrong gender and they're like, it's a boy. And we're like, take a look again. And you like hold the baby up and like spread the legs a little more, and they're like, oh, it's a girl. It's just so funny to me. That's always like really hilarious.
That would be hysterical.
Yeah.
Like, how did you mess that up?
Like, I think they're just so shocked in the moment. There's so much going on, and you're like, oh my gosh, this baby we didn't know if they were a boy or girl for 9-10 months is finally here, and they see something, and sometimes things are a little bit swollen, so I will give them that.
Yeah.
But yeah, that's always really funny to me.
Okay, so being an L&D nurse, could you ever see yourself doing a surprise birth?
If I were to have 3 kids, like pregnant with my third, and I have a boy and a girl at home, then I feel like I could do a surprise birth. But those people are so strong. I'm like, how, especially for your first baby, I'm like, I feel like I'd be so excited to like buy all of the things. But honestly, surprise births are one of my favorite things to be a part of. They're like so much fun. I don't even look ahead in the prenatals because I don't want to accidentally like so ruin it.
Oh yeah. You could unintentionally be like, and that's it. That's it.
And I'm like, oh my gosh, you went through all these things and now like I'm the one who ruined it. But,
oh my God,
and then
pressure.
I also like to be surprised too. Like it's just so much fun. But yeah, I always tell them, I'm like, no matter what, it's just force of habit. I will probably call your baby a boy or a girl. I promise I don't know. And I really don't, because I'm like, I'm not looking forward. Because you're just like, oh, let me adjust him on the monitor. Let me find her heart rate or something. And I'm like, I swear I do not know.
Oh my God. The amount of times I've walked in a room and the baby is a boy and I'm like, oh, how is she? And they're like, it's a boy. Yeah. And I'm like, it really doesn't matter.
I'm sorry. I don't mean anything by it.
Not at all.
Yeah.
It's like your baby is swaddled with a hat on. Yeah. And all I can see is its eyes and its nose.
And it's
like
the pink and blue hat. Yeah.
Yeah. Like I'm like, I haven't even gotten a report yet. I'm sorry. It's not. I'm sorry to misgender your baby. Yeah. Like it's so offended.
I know.
So looking ahead, what kind of nursing do you plan to focus on?
I honestly feel like I'm so happy where I'm at right now. Yeah. Like I've always dreamt of labor and delivery. I've always dreamt of working at the hospital that I was at. So when I was working in trauma, my mind was always, okay, we got to get to labor and delivery. And then I get to labor and delivery. Okay, we got to get to that dream hospital that you've always wanted to work at. And then you get to the dream hospital and you're like, okay, I got to get off night shift. I got to get on to day shift. I got to feel like a normal human.
I remember you getting on day shift.
Yes.
It was like, oh my God, how long did it take you?
4 years. Yeah. 3.5, 4 years I worked night shift.
That is so long.
Yeah.
Anyway, okay.
And I'm somebody that's never pulled an all-nighter in my life. Like I was always the first to fall asleep at sleepovers. My bra would be frozen in the freezer. I would always have the pranks pulled on me. So night shifts, that chose me. I did not choose it, but I loved it. I loved the people. But yeah, then I get to day shift and I'm like, okay, now what? And so it's been kind of a funny thing, like just being happy and where I'm at. Because I did start a BSN to DNP program. I did 1 semester with the focus I was going to go into like fertility and do something like that. But then I did 1 semester and I was like, like I think it's okay. Like this is what I wanted, and like I'm in my dream role. I'm in my dream hospital, and like I genuinely love what I do, and I feel like a lot of people can't say that about their job. Another good thing about nursing is like I genuinely love it. So I'm like good where I'm at right now.
That's beautiful, because I feel like a lot of people can't sit where they are and just be like, I worked really hard for this. Let me enjoy it. I feel like, you know, maybe it's living in America or whatever it may be. I feel like there's always this push for like, what's next? Like, you shouldn't be okay with where you're at. And it's like, how hard I worked to get here. I'm going to enjoy this. Yeah.
And I always get frustrated when people are like, oh, are you going to stay just a nurse? Like, I am not just a nurse. I am a nurse. Like I am a nurse. Like and that's another thing is I feel like patients, they're always like, well, when's a doctor gonna come in? Like when we're pushing and they haven't seen the doctor all day. And I'm like, oh, they come in like for the birthday party. It's okay. Like we'll call them and they're like, God, like I didn't realize how much like nurses actually do.
100%. Yeah. We do the whole thing.
Yeah.
We do almost all of it.
Yeah.
Literally, it's crazy. Yeah. So, you know, I feel like just to ask, have you ever considered becoming a midwife?
No, actually. I feel like it just goes back to like, I'm happy being in my role. Midwives are really great because I feel like they are with their patient more so than some doctors will push with their patients and things like that. But I feel like midwives, because typically you were an L&D nurse before that, like you kind of miss that. But there's still always going to be that L&D nurse there. And like my favorite thing about my job is the bond. Like it all goes back to the bond.
Course. Yeah, I'm the same way. Like I really genuinely don't think I ever want to be an NP.
Yeah.
Ever. Like I'm very happy with being a nurse and I think that's more than enough.
Yeah.
Not everything is meant for everyone.
It's true.
And just because we went to nursing school doesn't mean we're going to be a nurse practitioner.
Yeah.
Because it's
and like
and I love what I do.
Nurse practitioners, like I love them. We need them. But yeah, I agree with you. Like being a nurse is more than enough. We do so much.
Absolutely.
Yeah.
Yeah. If you could go back in time and give your baby nurse self one piece of advice, what would that be?
Go into it with an open heart, and you can't ever go. I remember a professor telling me this in school, like, you don't go to be a nurse for the paycheck. And I remember thinking back then, I was like, what, 20 in nursing school, like about to graduate. I'm like, oh yeah, whatever, like nurses make this, they work 3 days a week, like it's gonna be so much fun, whatever. And it's so true because you cannot, this is a job that you cannot go to just collect a paycheck. Like your heart has to be in it, and just to keep pushing to like find your niche and like what I wanted to do. And I'm glad that I did that.
Yeah, you were like, I'm going to be an L&D nurse, and it happened. And here we are.
Go for it.
Yeah, absolutely. Okay, so if someone were to come to you and say, I'm really thinking of becoming a nurse, what would you say, and would you recommend it?
I would recommend it. Yeah, I would say that it is the hardest thing I've ever done. You see those memes where it's like, what's the craziest thing you did for money? And it's like all the nursing students there. And it's so true. It's the hardest thing that I've ever done. I think probably that I ever will do. But it's so rewarding, so vastly rewarding, that I definitely recommend it. But your heart's got to be in it.
Absolutely.
Yeah.
You got to love people.
It's true.
Yeah. Well, thank you so much for coming.
Yeah, thank you for having me. This is so fun.
All right, guys, don't forget to like and
subscribe.